Sorry about that. And another job is to clear toxins out of the body. And it's also another job is to take all the hormones that we have in our body, to convert them, break them down, and to get rid of them. Can you imagine what most men would be like if the testosterone they started producing as a child was still in their body and it continued to accumulate over all the years? Men can be wacky enough as it is, but if they had all that massive amount of testosterone in their bodies, it'd be like a triple Y chromosome. Have to lock everyone in prisons. So testosterone is converted in the liver so that it can be excreted. Estrogen and progesterone as well. So those are jobs the liver has. But the liver has such a long to-do list. When we're in an environment where there's a lot of toxins, the liver has to clear those also, and it can't always keep up. So it's really important to take extra things to support the liver's ability to clear those out of your body, because the mercury, the lead, etc., that's bad for your nervous system. If you want to preserve your memory as you get older, very important to make sure you don't have heavy metals still in your system. Dental amalgams actually do leach out into the bloodstream, and they can cause neurotoxicity too. So those are some sources of toxins that you want to have out. And individuals who are obese, who are overweight, may be keeping the fat on their body because they aren't able to clear the toxins out, and the fat is a buffer for the toxins that are fat soluble that the body needs to get out in order to get rid of the fat. So one of the things that we do, one treatment to help reduce and to take the weight and the stress off of joints if you're heavy, is to do cleanses to help the liver convert things so it can be changed into water-soluble form, so you can either pee it out, poop it out, spit it out, sweat it out, cry it out, or what other kind of liquids do we get out of our body? Snot it out, maybe? So we were talking about various supplements that are helpful, and omega-3 fish oils.
So you mentioned that the DHA should be 3 parts?
Well, naturally, the usual ratio of EPA to DHA is 3 to 2. However, if you're taking the omega-3 fish oils that are clean, if you're taking them for the purpose of enhancing your brain function and your memory, then you would want to take a higher concentration of DHA, or more added DHA in combination. Okay? So in the next slide here, we also say that proper diet can have a hand in the prevention of or relief of arthritic pain. And you'll see here pictures of junk food, right? Colas, sodas, potato chips that have been cooked in trans fatty acids, cookies, things of that nature. And overweight people are more likely to develop osteoarthritis than people who don't have the extra weight. And so for those people who are overweight, diet is a critical part of a complete program to be healthier. Exercise is very important. It can help relieve arthritic symptoms as it strengthens the bones, muscles, and joints. It increases flexibility, it prevents joint deformities, and improves the immune system and reduces stress. Exercise has been studied well. It's a great thing to do. Now, some people it may be difficult to exercise because of arthritic pain. And so actually dealing with that pain without damaging medications is a very important thing to do. I'll talk about that momentarily. But forms of exercise that are good include things like walking, at least 20 to 30 minutes a day, and actually moving the joints. Like if you're sitting there, maybe while you're walking, move your shoulders around like this. Big circles, both directions. Over your head, around behind your back. Each joint wants to move as far as it can. And if you don't tell it how much you want it to move, it's going to end up staying in the position you do. They used to put people in slings after particular injuries, and sometimes you have to do that. to immobilize it. But they found that immobilizing the arms and the elbows, etc., for too long causes almost a paralysis. You put it in a sling for too long, the body says, okay, let's just make it work so it stays like this, because you haven't moved it. So while you're exercising, be sure to use every joint. Who cares what you look like going down the street? I mean, you know, you may feel a little self-conscious at first, but I do it all the time. Oh, that person just like pretending like they're swimming in the air, or you know, it's like an angel flapping its wings or something. I don't know. Just move them all directions as you're doing it, because as you're walking, you're exercising the lower extremities, but the upper extremities may not get the exercise and the range of motion that they need. Swimming is a great exercise. Bicycling is very good. If you do have osteoporosis and at risk of that, then it's important to be careful if you're biking and stuff, because you don't want to fall down and break your hip. Stretching is very good, so yoga or other types of gentle stretching. I know that that you have Tai Chi classes here also, once a week? Qigong. Oh, Qigong, that's what it is. And Qigong was today before this, right? Qigong is a very good exercise. You also, there is some larger movements that you do in the Qigong, right? Or not? So there's somewhere you do larger arm movements and all too, and that's good for stretching the joints and going to the end range of motion with joints, essentially going as far as the joint will go, and then you try to go just a little bit more, because you don't want it to lock up. You don't want your body to produce more bone at the end point of the motion. There's a certain distance it'll go, and if you go less than that, the body will start to produce more calcium. It'll put more calcium in, and then you can't move it. Calcium is deposited when the body with inflammation says, you know, I don't think this joint's strong enough. Maybe we should throw some more calcium in there to make it stronger. It's just like if you have thank you for coming. Did you want to enter the contest? Or? All right, very good, thank you. So with inflammation, the body puts more calcium in. Just like if you own a home and maybe there's a fence post that's sort of rocking a little bit, and there's some, you know, there's concrete there, but you say, if I just pour some more concrete in there, it'll make it more stable. The body does that too with joints. It says, if I put a little more calcium in there, maybe it'll be more stable, but it might restrict your range of motion, so move in big circles. Now, strength training is also good for the joints, as long as you do stretching and strength training. Now, in addition to diet, and in addition to vitamins, in addition to exercise, we also acupuncture. How many people have used acupuncture? Great. For arthritis or for other things?
I feel down the pulled muscle.
So a pulled muscle?
Yeah.
All right. Very good. So as you may know, acupuncturists specialize in handling physical problems with a combination of exercise, nutrition, herbal medicine, and increasing the normal circulation of blood and oxygen through the body by doing acupuncture, because it opens the flow of blood so that the tissues and the organs can operate properly. Oriental medicine serves more than 12 million Americans and 2 billion people worldwide. How many people live in the world now? How many of us are there? I think it's about 7 billion. So 2 billion out of 7 billion, that's a pretty high percentage of people who actually use acupuncture. Oriental medicine and acupuncture have been used in the Far East for more than 3,500 years. Many people are unaware that acupuncturists are required to complete a 4-year postgraduate degree. And our education is devoted to a wide variety of scientific studies, such as anatomy and biochemistry, microbiology, anatomy, pathology, public health diagnosis, clinical disciplines, and health sciences, in addition to the intensive study of acupuncture and herbal medicine. In order to prevent or reduce the pain of arthritis, it's important to make sure that blood and energy in the body flows properly to the joints so that they can function properly. And acupuncture does that. There was a study that was conducted in 2002, and 182 rheumatoid arthritis patients were treated using Chinese medicine, as you can see up here on this slide. Of these patients, 65% were cured of their arthritis, and another 19.2% experienced marked improvements in their symptoms. Click. In another study, acupuncture was compared to piroxicam, which is an anti-inflammatory drug, in the treatment of osteoarthritis. It was found that acupuncture was twice as effective in eliminating pain over a 16-week period as that anti-inflammatory. According to the National Institute of Health, there are few, if any, negative side effects from acupuncture treatments. I'm going to read a couple testimonials here. After receiving another doctor's treatment for over 9 months, I was still having severe pain in my left hip. A friend recommended her acupuncturist. After 2 months of treatment, the arthritic pain in my hip was greatly improved. People should not hesitate to try acupuncture treatment. It is so painless and has very good results. Kay Kinsley in Baltimore, Massachusetts. I would like to thank you for being able to help me in coping with my problems of arthritis through acupuncture and herbal medicine. The drugs I was taking to reduce the swelling worked okay, but you've been able to reduce the swelling even more in my knees until there is almost none. The arthritis in my hands, especially in my left hand, is almost gone, and I again have the strength to pick up pots and pans and even lift my arms straight above my head. And obviously, if you're having arthritic pain here and here, it can really restrict your ability to cook, to do household duties, to put things overhead in cabinets. So, because my purpose is to help as many people as possible achieve maximal health and vitality, I would like to offer each and every one of you a gift of a free consultation in my office where we go over your health history in a comprehensive fashion and see if there's anything I might be able to do or someone else might be able to do to assist you beyond what you've already been doing for your arthritic condition.